And we're recording. Okay, so Jim, it's lovely to meet you. My name is Kyra Meyer, and I work at the clinic here. I'm the behavioral health person, which is a really wordy way of saying I help people do some life change stuff so that their medical conditions are a little bit better. So, is it okay if we spend some time today together?
Yeah, this is never seen or heard of something. And it's nice to meet you too. My name is Jim, but you probably know that. So
Yeah, well, your doctor did give me your file to really quickly look through. Um, And really, my only goal is to just try to find some workaround solutions so that you can have a better quality of life. So when I was perusing through your file, I noticed a couple of things. I noticed that your PHQ two, which we had you fill out in the waiting room, you scored a 5 on, which is pretty darn high, and we need to talk about that. But I also
oh,
saw
okay.
that I also saw that you're really kind of struggling with pain. Can you tell me a little bit about what's going on?
Yeah, I feel like I feel like a frisky 60-year-old, like frisky 60. Um,
Yeah.
I tried to I try to get out there and live, but you probably can see from my chart that
Mhm.
I have brittle bones. I'm overweight, and I just hurt
I bet.
all over, like all the time.
I'm so sorry to hear that. So,
Thanks.
on a scale of 1 to 10, 1 being no pain at all, 10 being, man, this is like being eaten by fire ants. This is the worst I've ever felt in my life. On a normal day, where's your pain?
So they've asked me this question
Mhm.
before, and honestly, I'm gonna say like when it's bad, it's at a solid 7 for sure.
Oh, wow. How often is it out of 7? How many days a week?
Well, it just depends on what I'm doing. I mean, there's like a day of the week, it's Saturday, where I just try to do everything at once. So that's the worst day. But most of the time, I mean, maybe 2 or 3 days out of the week where it's a 7.
Okay. Wow. So, you mentioned that you try to do everything on 1 day a week. Can you tell me a little
Mm.
bit more about that?
Well, I guess I reckon that I could minimize the pain I felt if I put the activities on one day,
Oh,
right? That might, have that one day that just totally sucks, and then the rest of them suck less.
that makes a lot of sense. How does that work out for you, though?
Um, I mean, honestly, I feel like crap, like both physically and mentally. Now, I'm not one of those things like I can't go on, but like it it just it just sucks. I mean, it's difficult to move around.
Yeah.
Um, I'm divorced. Um, and when you're 60, it's not like in your 20s.
Yeah.
Um, don't have a lot of my friends. I used to be really athletic and go to the gym a lot and stuff.
Hmm.
But then that brittle bone thing developed. But a lot of my friends have passed away. Like 60 like came on fast on me. I didn't consider myself to be like like old, but like
Yeah.
60 is like old.
It just kind of hit you all at once.
It, well, it just I haven't started thinking about it until like maybe, yeah, I guess like since my birthday, like 6 months ago.
Mhm.
It was just like, holy crap, I'm 60 and I'm really hurting. And like, how is the pain going to be years on down the road, right? Is it going to be the
Yeah.
fire ants, 10,
All the
you
time.
know?
Yeah. I
Yeah.
understand.
So yeah, I certainly sure as hell don't want to go through that.
No, I don't want you to go through that either. That sounds miserable. So tell me about the relationship between your pain and your depression and your anxiety. Is there a link there?
Well, I take Noxalone for pain,
Mhm.
but you know, food. There's a reason it's called comfort food.
Yeah.
And I have all the you know garbage restaurants, fast food places around me, and um, eating like at least for a little while, it seems the pain not so bad. But then I'm like old, and then I just recently had a colonoscopy,
Mm-hmm.
so that wasn't fun.
No, those are
Right,
never
and
enjoyable. Mm-mm.
yeah, and so I realized through a conversation with that doctor, like how overweight that I'd gotten and how bad that is at age 60, and blah 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 blah. I'm just like, it all sucks.
It all sounds like you're a little overwhelmed by it all.
Yeah, that's that's a good word.
It also kind of sounds like it's like a spider web or like a ball of yarn. Like you don't know where to start to untie it or which to tackle first. Is that right?
Yeah, I'd say, yeah, it's all linked together.
Yeah.
Yeah, if pull on something, the rest of it's gonna come into the picture or whatever.
Mm-hmm. It might unknot, but it might get into an even worse knot.
Yeah, maybe.
So, like I said, way at the start of this chit chat, when I was looking through your file, I saw that you did the PHQ-2 in the waiting room and you scored a 5, and that indicates some real concerns for depression. What do you think about that? What's that like to hear?
I mean, it's not surprising.
Yeah. Are you okay? I'm reaching. I have another form here. It's called the
Okay,
PHQ-9. It's a little bit more in depth. Would you be up for filling this out for me and then we can talk about it real quick?
sure.
Okay. So, through the magic of Zoom, we have now accomplished these things. Woo! All right. Well, Jim, I'm looking at your score here. And on the PHQ-2, like I said, you scored a 5, which indicates we needed to do the 9. And this one that you just filled out, you scored about a 17, which is moderately severe. Normally, the proposed treatment recommendation for that is we start looking into either counseling or maybe start thinking about a medication. How do you feel about that?
I'm open to discussing medication. I mean, I'm 60 years old, and I feel like I did a lot of, well, maybe my ex-wife would disagree with me, but like I did a lot of life without boozing or taking a bunch of
Yeah.
pills or getting drugs or all that other kind of stuff. I mean, I used to have a real problem with anger, but I hurt too much for that now. But I mean, I'm 60 years old. I mean, I know plenty of other people at this age are on
Yeah.
some kind of something.
And for what it's worth, a lot of the clients and patients in this clinic that we do put onto an antidepressant to combat, and it'll combat both your depression and your anxiety. Um, Sometimes it's just enough of a perk up that then they can start working on addressing some of the other issues like the pain and maybe coming to terms with your weight and all of those other things. What do you think?
Okay, so when we talk about kinds of medication for depression or anxiety, is that, I mean, I assume that's the tunnel that we're down right now. Like, what, what kind of options?
what's out there?
Yeah.
Yeah, that's a great question. So I'm gonna, in a couple minutes here, I'm gonna have your PCP come back in so that way we can have that discussion with your medical doctor. But for the most part, there are a couple different classes of antidepressants out there. There's MAOIs, SSRIs, and it's all about how they interact with your brain chemicals and your brain chemistry. Most people start to feel the effects in about 6 weeks. And here's what's hard about them. Man, you just want to take a med and have it feel better, but you got to wait a little bit. What do you think about that?
Yeah, I don't want to be a zombie.
Yeah.
That's
I,
all, I'm really concerned about. I don't want my life to feel like anything's going to be reduced or I got to like, hey,
yeah,
Jim, don't take this while getting in your car.
totally. Most antidepressants don't have those side effects, but it's really good that we're having this discussion about them. It's important to be informed. Um, the the other bit that I would encourage you to bear in mind when we're talking about this is I don't want you to feel, Jim, like we're going to give you a script and kick you on home and we never do this again. What I would
Okay,
really like to do is I would really like to check in with you about every 10 days via the phone just to see how things are going and what progress you're making. Is that okay?
sure.
Awesome. Good. I'm happy to hear that. So, to summarize, today we've talked a little bit about your depression. We fleshed that out. We talked about your pain. We talked a very little bit about your support system, but not a whole lot. And I think we came up with a really good plan of getting your PCP involved. And we talked about how my follow up with you is going to go. Does that sound good?
Sounds good. Simple enough.
Anything else that we need to talk about before I pull your doctor back in here?
No, I don't think so.
Awesome. Well, thank you so much today for your time, Jim. It was really a pleasure to meet you.
Yeah, it was nice to meet you too. I just felt nice, like different. Someone wanted to actually speak to me. So,
Yeah, of course. Okay, well, I'm going to go grab your doc, okay?
okay, thanks.
Uh huh.